I am Bern Melnick, and I have the distinct pleasure of serving as our university's Vice President for Health Promotion, Chief Wellness Officer, and Dean of our College of Nursing. Today, I am so excited to introduce one of my absolutely fantastic faculty, Dr. Karen Moss. I was really blessed to recruit Karen to our College of Nursing a few years ago, and she is doing amazing work. She is a terrific scientist. Her research focuses on the neuroscience of pain, advanced care planning, healthcare decision-making, and quality of life and outcomes in people living with Alzheimer's disease and related dementia. This is such an important topic because often we wait until crisis happens to make decisions. My sister-in-law recently had a hemorrhagic stroke. So I had encountered this particular situation with my brother very recently. So I am thrilled to have the expertise of Karen with us today to talk about this extremely important topic. So with that, Karen, please take it away.
Thank you very much, Dean Melnick. It is my pleasure to be here and to share with you all. I am going to go ahead and share my screen. Right. Are you guys able to see my screen? I don't think so.
It looks great.
You do? Okay, perfect. All right, so here we go. Good afternoon. As mentioned, I am Dr. Karen Moss. I am an assistant professor in the colleges of nursing and medicine here at Ohio State University, and I am delighted that you are here. This afternoon, we are here for a midday conversation about a topic that is near and dear to me both personally and professionally. In my almost 22 years as a registered nurse, and also, as Bern mentioned, because of my research program. We will be talking about healthcare decisions review, including what is called advanced care planning or planning for the end of life. And so I am approaching this topic today not from a wholly scientific standpoint, even though it's scientifically based, but just to make it more conversational. We will have time for questions at the end. I have no financial conflicts of interest to disclose, and however, included in my presentation are several resources for the sole purpose of providing you with a few different options to help you think about your healthcare decision making. However, there's no relationship with these entities. Before we begin, I would like to pause to draw your attention to a few resources, because we know that this topic, though necessary, is often challenging to even think about. So I offer you several resources available here at OSU and the larger community. So for my undergraduate, graduate, and professional student guests, there's the OSU Counseling Service, or CCS. If you are faculty or staff in the OSU family, I offer you the Employee Assistance Program. If you happen to be a member of the larger community or would like to be connected with a counselor outside of the OSU community, the third option listed here is on our CCS website and will help you search for a provider. And last but not least, there's also the 24-hour access line if you are in crisis and need to speak with someone immediately. The impacts of grief and loss are real and at this moment are quite evident in our society and worldwide, both COVID-19 and otherwise related. So please take care of yourselves and let's also do the same for each other. This slide will appear again near the end. So here's our roadmap for our timeline together. In the spirit of getting things done, I presented to you as our agenda. I am a huge fan of checkboxes. I will first share a personal story. We will be learning about planning and discussing or talking about your plan, documenting your plan, sharing it with others, and reviewing it annually. Then we will talk a bit about National Healthcare Decisions Day. Take note of the trend here. It is all about you. However, I encourage you to also think about others in your family and in your networks who will also benefit from advanced care planning. So, before we jump in, tell me, who are you? Nicole, would you please launch our first poll question? So what is your role at Ohio State? And you can see your options listed there. Thank you so much for your responses. Quickly. Right. 93%. You guys are getting an A already. All right, I will end the poll there. Thank you. All right, so it looks like we have the largest majority of university staff and then followed by med center staff. This is great. We have some students and also faculty on the line. All right, always good to know who's in the room. So, because we all have a story, I would like to introduce you to two adorable older adults who taught me my very first lessons on older adulthood and death and dying. The first one pictured here is my maternal grandmother, Caroline Monroe, affectionately called Granny, who died of colon cancer in her 80s. She was hospitalized for months on end for multiple surgeries and other treatments. She had a colostomy, and it was her illness that actually helped me to determine that I wanted to become a nurse while in middle school. She lived for about a year after being diagnosed. When it was time for her to die, she was transferred back to hospital. Thankfully, she was not coded. On the other hand, her brother, my Uncle Edgar, whom we affectionately call Pa, died in his 90s of natural causes at home, peacefully in his sleep. These two dear loved ones, along with my patients and their families, taught me how important it is that we plan and prepare as much as we can for the end of life, and the importance of the role of surrogate decision makers, often in the form of family caregivers. So from these two personal experiences during my formative years, I knew that if I could decide, I would have wanted to die just like Pa did. While death and dying is not fully in our control, there is perhaps at least one aspect of it that we can control. But in order to do this, we must be willing to have the conversations. So because we know that words and their meaning matters and can be a point of confusion for many, here we have a few, I'm listing a few that you should know. The first is advanced care planning. This is an ongoing process of communication that includes understanding, reflecting, and discussing future healthcare decisions. Advanced directive. These are written instructions letting others know the type of care that is wanted if a person becomes seriously ill or is dying, and include a living will and healthcare power of attorney. Advance directives can be completed and signed at your doctor's office or hospital. It just needs to be signed by a witness. Many hospital systems have their own form, and even the state of Ohio has a form, which I've included here, and you'll see later on in this presentation. Healthcare power of attorney. This is the person that you want to make choices for you, often called an agent or proxy or healthcare surrogate or surrogate decision maker. These individuals are oftentimes our family caregivers or sometimes referred to as care partners. A living will is a record of your end-of-life care wishes in case you are no longer able to speak or make choices for yourself, and this is typically drawn up by an attorney. Palliative care is specialized medical care for people living with serious illness such as dementia, cancer, heart failure. Patients receiving palliative care may do so for symptom management, along with treatment intended to cure their serious illness. Palliative care is meant to enhance a person's current care by focusing on quality of life for them and their family. So think of it as symptom management, such as pain, anxiety, shortness of breath, or breathlessness, nausea, etc. It does not always include end-of-life planning. Any one of us at any time can benefit from palliative care, even if we are not seemingly near the end of life. End-of-life care is the term used to describe the support and medical care given during the time surrounding death. This type of care does not happen only moments before breathing ceases and the heart stops. This can include significant care needed for days, weeks, and even months before death. Hospice care is the way in which care is provided to seriously ill patients who are nearing the end. It includes care for families. Hospice is an approach to care, so it's not tied to a specific location. It can be offered at home, in a facility such as a nursing home, hospital, or even in a separate hospice center, or in some instances, there are hospice houses that exist as well. So, according to a national survey from the Conversation Project conducted pre-pandemic, while 92% of Americans say it's important to discuss their wishes for end-of-life care, only 32% have had such a conversation. And while 95% of Americans say that they would be willing to talk about their wishes, 53% even say they'd be relieved to discuss it. Yes, only about 30% of us have a living will. That's that actual document, according to these study results. So what we see here is knowledge of its importance and a strong desire to get it done, but we lack follow through. While having the discussions are important, we need to document it and make it known to others. The saying that starting is always the hardest part is perhaps true here. We are beginning to see evidence that since the peak of the pandemic, as a society, we are having more of these discussions. This is likely attributed to the amount of death and dying that was occurring during the peak of the pandemic. So we will perhaps see these statistics begin to change. So why is this so important? Just to remind you or to provide some perspective on what has been done in terms of end of life in the United States thus far, here are some examples of national developments. In 1990, we had the Patient Self-Determination Act, which required Medicare and Medicaid funded healthcare organizations to empower patients to refuse or accept medical care and execute advance directives. In 1995, the support study confirmed substantial shortcomings of healthcare for seriously ill patients near the end of life. From these findings came the Institute of Medicine's report, Approaching Death, Improving Care at the End of Life, which further demonstrated the need for evidence-based end-of-life care models to improve this healthcare outcome. Almost 20 years later, the Dying in America, Improving Quality and Honoring Individual Preferences Near the End of Life report was born. Among other things, this report calls for continued improvements in quality of life through the end of life and highlights the need for culturally relevant, person and family-centered end-of-life care with a focus on the mentally incapacitated. In January of 2016, we saw CMS reimbursements for providers engaging in advanced care planning conversations. So as you can see, we have made considerable progress, but as many of you perhaps have observed in your own practice, there is still much work yet still to be done with this regard. In reviewing a recent health affairs publication that included a look at this outcome, I was happy to see that there had been a substantial increase in outpatient advanced care planning claims between 2016 and 2019, although prevalence remained low, below 7.5% for all patients subgroups analyzed. The claims for Black, Hispanic, and Medicare dual eligible patients and patients with comorbidities were less likely to include this discussion in their annual wellness report. This was also said to be largely because they have fewer such visits overall. So this is a health disparities issue that must be rectified. So, okay, let's pause here and take a temperature check and see what are your thoughts about planning. Nicole, if you would launch our next poll question, please. This is looking really good. Wonderful. So we're kind of preaching to the choir here. But that's okay, because all that says to me is after this, I will have a ton of champions who will continue this journey along with me. And I will share some ideas later. Awesome. So the importance of planning, as you all will share with folks in your network, it promotes quality of life, prevents or reduces unwanted emergency room visits, as does unwanted hospital stays. It promotes comfort through better pain management, as an example, reduces the stress for caregivers and other family members, and of course, lowers the cost of care. And this is both the cost that reaches the individuals and costs that are absorbed by healthcare systems. So the 5 W's, the who, what, when, where, and why, as a part of this conversation is extremely important. If and when you are no longer able to make these decisions for yourself, who will make these decisions on your behalf? Will it be a spouse, your adult children, your parents, or a trusted friend? And remember, just as your choices on what you want can change, who you assign can change as well. We think about shifts in family dynamics, marriage, divorce, to name a few. You want to make sure you reconsider who you have assigned as your life circumstances changes. And have you discussed it with them? The person who is assigned, for example, to be your surrogate decision maker should be aware. So it is recommended that you should have this individual or individuals be involved in this process, or at least make them aware of their role as a surrogate decision maker. And who will include family members, trusted friends, healthcare providers, your physician or a nurse practitioner, a nurse, social worker, chaplains, your faith leader or spiritual leader, perhaps your attorney, are all great individuals to possibly include. Other key considerations regarding end-of-life care. So family structure, family culture. What is the norm within my family? Is this fairly accepted? Are people resistant to it? Are all things that will help you to think about how to approach this within your own families. Think about relationships with healthcare institutions and healthcare providers. If you are a provider, for example, thinking about trust in healthcare systems and mistrust. We know that there are lots of historical reasons for why this is that can help individuals that promotes hesitancy with individuals to sign another document. So that's something that definitely needs to be considered and needs to be talked about as part of this conversation as well. location of death, whether or not palliative care service will be used. And just to step back to location of death, thinking about folks who make decisions to want to die in their homes, some who will prefer a location otherwise such as a hospice house. The importance of faith and spirituality is a coping mechanism here, and also family caregiving and all that comes along with that. And then the use of hospice care, and I will just say quickly about hospice care. The downfalls is we don't, the typical model of care that we oftentimes don't have folks enrolled early enough to get the true benefits of this model of care. So let's be real. These conversations, as I think most of you know, are not easy. There are beliefs that if we ask about death, it will happen. So let's not talk about it. But as I mentioned, most of us know that none of us are going to get out of here alive. So we need to have the conversations. We may like to think that we have these conversations once and be done, but our health needs, our beliefs, and our experiences change. What we really need to do is to put a pin in these conversations and have them at least once a year. And we will talk about why this time of year is so special to be able to do that. So think about it as a gift that you're giving to your loved ones. When your plan is documented, please share it and do that with the important people in your life. Make sure you tell them about it, give them a copy, let them know where they can find a copy, whether it's in your home, in a safety deposit box, at an attorney's office, etc. Think about it as a part of your legacy. Encourage others to even think about it as a part of their legacy. We all desire to leave behind a good legacy, so make this a part of it. Dying well is a part of living well. So, what about you? We have talked so far about a lot about other people, about your thoughts. So what about you? Let's pause here for a pulse check. Where are you on the planning spectrum? Are you at the point where you have not had any thoughts about this prior to today? So you say, I'm good, or so you thought. Or are you done with discussions, completed the documents, and you're now having these conversations annually? So you've checked all the boxes? Beautiful. Look at that. Or are you somewhere in the middle, which seems to not necessarily apply? I'm happy to say that you're not interested. I think, let's see. Is this the third question, Nicole?
Yes, I'm getting it up now. My computer
Okay.
is slowing down. Give me just a second.
Okay.
There we go.
All right. So here's our third question. To complete the following statements about where you are with your plans. I can live with this. Yeah. All right. So as far as we have right now, we have no one who says that they've not thought about it at all, which is phenomenal. I'll take that. And over 50% of you have spoken to others about it. So congratulations. That is phenomenal. So for those in that category, we just, and the category before, we just need to move you up to where you have your advance directives documented. But you guys are doing great. And I'm hopeful that after this conversation today, you'll be inclined to move to the next step. Wonderful. So here's the awesome news, or here's another set of awesome news. It is certainly not by chance that we are speaking about this today. Tomorrow is National Healthcare Decisions Day. Yay! Which is the day after taxes are due, and a day set aside to have these conversations and to update your plan. So just like renewing your taxes should be on your calendar, so should this. This movement began back in 2010 and is a public campaign to help everyone to talk about their wishes, to care for care, sorry, through the end of life. So those wishes can be understood and respected. Yes, this is transformative because the reality is that just as certain as the life that we're living, each of us will face death. And there's a good chance that we can have some control with what the end looks like. We must normalize these conversations and make them commonplace. A culture change, I get it, but we can do this. So if you need to begin, continue, or formalize your calculated decisions or update them, now is a great time to take care of that. And put it on your calendar, as I mentioned before, to revise as needed, at least annually. Don't have to wait till a year, but at least annually. So you may ask, Dr. Moss, where do I even begin? Well, I'm glad you asked. So, in person is perhaps most ideal, especially if your loved one is already facing a terminal illness and you're talking with them. However, or I should say you or your loved one. However, let's not forget that everything is always better around food. And it does not even need to be a special holiday together. You can include family members' recipes to be shared together, along with some good conversation. But the realities of this pandemic meant that we could not gather in person. So as someone whose family lived miles and miles away, I have been able to successfully have these important conversations with loved ones on at least 3 occasions now, all virtually. 2 of them were at a time when an aunt and an uncle was facing death, and one was actually during the pandemic. I am happy to report that both loved ones passed away peacefully just days later at home. So what I'm saying here is virtual conversations or even discussions over the phone are possible. However, I would be sure to prepare everyone by having other loved ones around them, if possible, for support. Asking lots of questions is a good way to go and have some suggestions. Have some suggestions on an upcoming slide. And my hope is that every family will be able to have this experience, whether it's around the dining room table, enjoying grandma's mac and cheese, or simply enjoying auntie's famous cookie recipe together over Zoom. By sharing these conversations with love, family, and perhaps food, we can make them cherished memories. And so listed here, I know it's a lot, but the slides will be shared. These are questions that are courtesy of the California Coalition for Compassionate Care that I thought were really thought-provoking. I also strongly encourage those of you with dependent children, grandchildren, etc., to include guardianship questions in your discussions, and also include plans to get that decision legally documented in the event of death of a caregiver, to ensure that your children are left in the hands of responsible individuals whom you trust to care for them in your absence. Even in instances of dual parent or guardianship homes, unexpected circumstances do occur, unfortunately, at any time. So be sure to make plans to keep our children safe. If you have adult children, please encourage them to think about this. Just as we can perhaps think of persons who we would not want to make healthcare decisions on their behalf, we also probably have a list of those we may not prefer to assume guardianship of our dependent loved ones. So please be sure to include this in your thinking. And so here's a bit of a fun one. There's a game called Go Wish. I have my pack right here. So the cards that are part of the game have some prompts. And the goal is that these prompts will promote discussion. And so these folks, probably not playing Go Wish, but let's pretend they are an example of just families getting together around the game to stimulate conversation. There's also the conversation starter guide. Most of these resources will be shared by email after the presentation. So I hope you get a sense that there are multiple ways to get started. As one of my mentors, Dr. Celia would say, there is no wrong door. So a couple references for documenting. So there's the 5 wishes document, which is a very basic walkthrough for considering what's important. Even though I have to tell you that if you live in the state of Ohio, which probably most of us do, the document will tell you that you need to take extra steps in order to use it. So use it as a conversation starter, get it filled out, take it with you to your provider, and then they can get it transferred onto a form that is accepted here in the state of Ohio. It is written in a very non-technical way for us to easily understand and think about what we would want or not want, to give it as a gift to other loved ones so they can begin thinking. It also includes a wallet card, which is great, that you can cut out and laminate. Nonetheless, it is a great way to begin your planning and to take it with you, like I said, to your healthcare provider. Next here is the State of Ohio Advanced Directive document. It is a 23 pager, so easy, light, late night reading, perhaps, to get your thoughts flowing or your loved ones' thoughts flowing about this. Links to that will be in the follow-up email. So in case you forgot, tomorrow is National Healthcare Decisions Day. Begin the conversation with your loved ones. For those of you who have already started yourselves, move towards documentation, include children in an age-appropriate way. Through this, we can create generational impact. Yes, even at celebratory dinners, we can do this. Because in the end, we will all have experiences with death and dying. And a conversation in advance can make all the difference in the world and lead to a better quality of life for everyone involved. Again, I want to make sure that these resources listed here are made available to you. So you can take a picture if you need it. Always go to our CCS website. We've come to the end of our presentation. This is a revisit of our agenda, and I think we checked all the boxes listed there. Thank you all so much for your time and attention. I will now take your questions or comments.
Thank you so much, Dr. Moss. That was such a great presentation. It's so informative, and we all really appreciate you sharing your expertise on this important topic that we all need this information. So thank you so much for that. To all attendees, as she just said, go ahead and post any questions that you have in the chat box. We'll get to them in just a second. I see we have some questions and comments in there now. I will just mention before we get to the questions that you all will be receiving a follow-up email. In this email, it'll have the slides, a link to the slides, some resources that Dr. Moss is going to provide us with, as well as an evaluation. So if you could take just a couple minutes to fill out that evaluation, it really does help us better our programming and make sure that we are giving you programs on topics that you all want to see. So be on the lookout for that email. It'll come out later this afternoon. Pull up the chat box. So we did have a question come in. If you could go back to the questions to ponder page that I believe was in your slideshow. They want to take a screenshot, but the slides will be going out. But if you want to pull it back up just so everyone can see it.
I fell in love with these when I saw it several years ago when I was in the program. Should be able to see it.
Great, thank you. Yeah, so we'll just leave that up for a couple minutes if some of you want to take a look at that. Like we said, the slides will be sent out later. So another question, is there a particular age or age range when we should start having these conversations, or is it just when it feels right for you?
That's a great question. We tend to think that older adults, folks with a lot of medical conditions, folks who are just not healthy at the moment are the ones that should be having these conversations. But this goes for all of us, right? So when we think about how we place our children behind the wheels of cars when they get their driver's license, and how at the DMV they ask questions like they see here, like organ donorship, So once you're able to legally make decisions on your own, you need to be having these conversations and getting them documented. And if you think about the well-known cases in society across the country that we have heard about, it's not necessarily the older adults, but those really complicated scenarios. It's the younger adults who may still have parents, maybe married or not, but still have parents who feel like they should be the decision maker when things happen. And because folks end up disagreeing on what should happen, then you have these really tumultuous family circumstances that it's extremely stressful, extremely painful for all involved. So I would encourage all of us to talk with your children in age appropriate ways, especially your young adults who are driving, who have driver's license, so they can begin to think about this, get it documented as they get older, and so that decisions can be as clear as possible.
Thank you. And we had another question come in asking about would it make sense to write a letter and attach it to your documents? They're thinking of answering the questions to ponder and writing it out in their proxy.
So I would say whatever is important to you needs to be included. So we have these formalized documents that have specific questions included. This is a way to get these questions to ponder as a way to get the conversation going, to help you think about what's important. Whatever is important to you needs to be included. So as you're documenting it, I know that in some advanced directive forms, at least the one that I originally filled out, had a space where you could write in things. So, for example, I have chronic shoulder pain. If I'm ever in the ICU for an extended period of time, my husband knows, and it's also documented, that I want my shoulders to be massaged if I'm going to have to lie still for any extended period of time. So something like that I know is important to me and my body. And so I included that. So if you feel that the details need to be in that letter, I think what is most important is that it's clear and that the person who's going to be making decisions on your behalf is aware and understands what you want.
Thank you. Do we have any other questions? I'm not seeing any right now in the chat box, but give it a couple seconds in case some more come in.
If I can just speak to Patrice's statement about her expressing looks like to her mom that she wanted to be an organ donor and it was not very well received. I think along with this, we have to be kind of sensitive to what the experience of others might be and how they may feel about these conversations. So that could play into the way that Patrice's mom's reaction to her statement and about the doctor, letting her die. And so I think a deeper conversation and some education around this. And thank you so much, Alicia, who is also very passionate about this topic, included Lifeline of Ohio that has some resources here that can help perhaps explain things to your mom. And oftentimes when we don't have the knowledge, we tend to not be able to think about things in a different way. So Patrice, I would encourage you to locate that resource and maybe have a deeper discussion with your mom about that.
Thank you for touching on that. We did have another question come in asking if there are any links to available forms that you could share. So if there are, we can include them in the follow-up email.
It will all come in the email, I promise.
Great. Okay, if we don't have any other questions, we can end about 5 minutes early. I can hang on a little bit in case some questions trickle in. But again, I thank you, Dr. Moss, for being here with us, sharing your expertise. Like I said, we all so much appreciate it. And thank you to everyone who attended and had comments in the chat. It was really active, and that's great to see. So be on the lookout for the follow-up email that I'll send out later this afternoon. And everyone have a great rest of your day and a great weekend.
Thank you. And thanks everyone. Patrice, the game can be purchased online. You can just Google Go Wish. That's how I purchased mine. But I'll also include the link for that website. And that might be a really good tool to help with conversation.